Hi, I'm Dr. Rene Forti Kohan, and I'm a pediatric emergency and urgent care doctor and a certified culinary medicine specialist. I'm a big foodie, and growing up, food was a part of everything. We cooked it, we talked about it, we celebrated with it, but over the years, food has become confusing and complicated. And culinary medicine was a way for me to alleviate the complication. By learning culinary medicine, I was able to realize that we can still celebrate and enjoy the foods that we like, but in a healthy way. When I was in medical school, there was very little talk about nutrition and lifestyle medicine. So we really just learned how to treat illnesses as they arrived. Culinary medicine has allowed me to focus more on prevention. I have the tools and the skills that I can meet my patients where they're at, and I can show them that they can continue to enjoy foods within their culture and in a very helpful way. And that's how I've been able to practice my medicine now. I talk about food a lot. I talk about it all the time, and at work I'm constantly talking about food. I work in a very busy urgent care center, and when I talk about food and nutrition, one of my colleagues had asked me, like, what about culinary medicine? And I was like, wow, I didn't even know that's something that existed. So I decided to pursue the certification at that time. Being able to do that, most of the preparation and the learning online was very helpful. And I was able to do that on the times that I wasn't physically at work. And then once I became certified, I started talking about it much more with my colleagues. And altogether, like, we do incorporate food as medicine policies into seeing patients. In the busy urgent care, it's a little more challenging because of time constraints, but we do realize that even having small conversations about food can have a big impact. I'd say absolutely do it. I say I would definitely pursue a certification in culinary medicine because food as medicine is it's a hugely expanding field, and we have the evidence and we have the skills to be able to teach people how they can empower people to use food as medicine. And there are some barriers, and I have to be honest with them about that, like time constraints, reimbursement issues, but that shouldn't discourage them. That should actually encourage them more, because the more of us who get certified, the more we can break down those barriers. My favorite ingredient to cook with is mushrooms. Mushrooms are nutritional powerhouses. They have an incredible texture and umami flavor that can be incorporated in all styles of cooking, from omnivore to vegan. So I really enjoy that. And my favorite meal to cook is Mediterranean fish. It's like you're in a 5-star restaurant, but eating a very, very simple to prepare dish.